Hi, I'm Dr. Rashmi Sharma. I'm Senior Consultant Dermatologist at Rosewalk Hospital. The most common skin changes seen during pregnancy would be changes related to pigmentation, pruritus related changes, skin tags, stretch marks, and vascular changes. During the pregnancy, under the influence of a lot of hormones, you see a lot of pigmentation changes. So very commonly which you would see is the side of the cheek would become pigmented. So I would get a lot of patients asking me, doctor, suddenly I've developed a dark colored band on my cheeks and it's really very stressing to the patients. So then what do? There are a lot of precautions which we do for this pigmentation, which I'll talk later. But this is the band of pigmentation very commonly encountered. Another thing which I've seen is, suddenly they would tell you that suddenly I'm getting these tiny black color mark on my skin. So what is that? That's also very troublesome to the patients. So then you'll also get increased pigmentation of already pigmented areas, like a band of the neck will become dark colored, your underarms will become dark, your private areas will become dark. So don't worry about it, because that is also something very common and it will go away after pregnancy. These are the changes seen during pregnancy. You would also see many times maybe you had some acne scar on your face which suddenly became more pigmented. So that is also under the influence of pregnancy hormones. Itch is really very severe during pregnancy. It can give you sleepless nights. I get patients asking me, doctor, I'm not able to sleep and the itching is so severe, it really gets into your head. So there are a lot of changes which can give rise to itching during pregnancy. And some of them are really important, and it is a pathological condition, which is seen during pregnancy. So skin changes during pregnancy, like you can get itching around the abdomen. So there's a characteristically which you see the stretch marks which appear. So you will have itching along the lines of the stretch marks, and it's very scratchy and very itchy. So that is seen as a common condition which is seen in pregnancy dermatosis, like pruritus is very commonly seen in that. Another thing which you also see is many times atopic changes are seen during pregnancy, and you can see atopic eczema also during pregnancy. And also your liver functions and all, urea and all has to be checked, because internal changes also lead to itching during pregnancy. Acne is something which is, you would see suddenly flare up of acne during pregnancy. So many times I would see people asking me, doctor, I have developing these acne over my jawline. So that is something related to hormones. Also, you would see during the third trimester that suddenly all kind of danas will appear on your face, and on the cheeks, on the forehead, on the chin area, which is like really troublesome. So during this pregnancy phase, I would like to strongly recommend you don't apply anything over the counter, because there are a lot of medicine which are really not recommended during pregnancy. You are growing a whole body inside your own body, so there are a lot of medicine which are not FDA approved. So consult your dermatologist and go for the safer options of the medicine which can be applied for acne. Also, there are a lot of peels also which can be done for acne, which is also safe during pregnancy, but you need to meet your dermatologist for the same. So stretch marks, as the name suggests, is really very stressing to the patient. When it happens, it's because of undue stretching of the skin, What is stretch marks? When you stretch the skin way too much and it is beyond the stretching capacity and it ruptures, and that's where you see the stretch marks appearing on the skin. So there are few cases where you see more of stretch marks. So what are these skin changes and what are these conditions where you see more of stretch marks? So when the age of the lady when she gets pregnant is less, like younger girl getting pregnant, so she will have a more chance of getting stretch marks. Another thing will be when there are multiple babies, multiple pregnancy. In that case also, because you have to understand this abdomen is stretching beyond. So that is another condition where you get stretch marks. Also, when the family history of stretch marks is present, when your mother has had stretch marks and your sister has had stretch marks, so you are probable candidate to get a stretch marks. Also, you can see stretch marks more in some of the, you're already having some kind of polyhydramnios, or there is more fluid in the abdomen. That is another condition when you can get more of stretch marks. So there are a lot of treatment which can be done for stretch marks. You can apply a lot of their topical preparation which is safe during pregnancy, which we can apply for the stretch marks. And also there are a lot of things which can be done post delivery for the stretch marks, wherein you can see actually up to 70 to 80% of improvement after the stretch marks, the treatment. So like, we do a lot of treatments like laser based devices, energy based devices, micro needling, radio frequency RF. All these are very nice treatment and which is safe and which is US FDA approved, and it's very effective for stretch marks. The vascular changes which you see during pregnancy, many times you would see, a red colored lesion would be appearing on the face suddenly, all of a sudden. It was totally okay, your skin was nice, supple, suddenly you get a red colored thing on your face. So what is it? It can be telangiectasia, which is nothing but a superficial blood vessel. Usually it's seen on the side of the cheeks, which is the common location for this telangiectasia to appear. Another thing which is very commonly seen is spider angioma, which is also seen around the face and other areas. You can also see increased redness of the palms. You will see like your palms will become more red and you'll have more flushing of the face. So all this is very normal, and these are normal changes seen in pregnancy. Another thing which I would like to talk about is you would see certain kind of vascular changes around the gums. The gums become more swollen, and sometimes you can have these tiny growth kind of thing on the gums. There's nothing, but there's increase in the vascularity which is giving rise to a medical condition called as pyogenic granuloma. That's also sometimes encountered, and all these vascular changes are very easy to tackle. You must consult dermatologist for the same.